Hello everyone, today's topic is preeclampsia. During time of pregnancy, there is increase of blood pressure. That is called pregnancy induced hypertension, and there is more chances of mortality, morbidity and mortality during the time of pregnancy. So, why blood pressure increases? That we learn from, that we see in this video. Then pregnancy, according to the pregnancy is 3 trimester: first trimester, second trimester and the third trimester. During the first trimester, if there is rise in blood pressure, that is before 20 weeks of pregnancy. Okay, so in that case blood pressure is increases, that is categorized as a chronic hypertension. Chronic hypertension. Then after 20 weeks of pregnancy, after 20 week pregnancy, if blood pressure increases, that is called preeclampsia. So first we know about what is the definition of preeclampsia. So the definition is, it is a multi-system disorder. Okay, why it is called multi-system disorder? As you learn in this, see in this video, it affects brain, liver, kidney. So multiple systems are affected by the this rise in blood pressure. And also unknown etiology, its cause is not known. Okay, cause and developed by hypertension. Blood pressure increases, one of the significant features. And also that to be how much, 140 by 90 mmHg. Okay, and with proteinuria. Proteinuria is one of the significant problem, that is proteinuria, that is the presence of protein in the urine. And another one is, that is edema. So three things are there present in the preeclampsia. One is hypertension, that is 140 by 90 mmHg, and proteinuria, that is the presence of protein in the urine. And another one is edema. Three factors that cause preeclampsia. Okay, so during the pregnancy, the if blood pressure is normally in pregnancy, blood pressure decreases due to the fall in the diastolic pressure. But if during the pregnancy, the first trimester, the pregnancy, the blood pressure increases, that is called as a chronic hypertension. So before, that is the first trimester, before 20 weeks of pregnancy, that is called chronic hypertension. Okay, so what happened, this is chronic hypertension. And it is mainly happen due to the presence of hydrated mole. And hydrated mole is one of the cause for the rise in blood pressure before 20 weeks. And after 20 weeks, why the blood pressure increases? After 20 weeks, if there is rise in blood pressure with protein in the urine, with associated with systemic features, means there is a that affect to the different organ, mainly kidney, liver, then eye. If these are things are present, that is called the systemic features, then it is known as preeclampsia. Okay, sometimes preeclampsia happens after 6 weeks of delivery. Just after delivery, the up to 6 weeks, in between that period, there may be chance of eclampsia or preeclampsia. So then another one is, if the pregnancy continue, then there is, during the time of pregnancy, the blood pressure increases, that is called gestational hypertension. So there are three hypertension. One is the chronic hypertension, second one is the preeclampsia, and the third one is the gestational hypertension. There is a difference. It is a chronic hypertension, that is before 20 weeks. It may be rising blood pressure from first trimester. But during preeclampsia, eclampsia, it is happens in the second trimester and the third trimester, just after 20 weeks of pregnancy. So the one of the difference in the preeclampsia and the gestational hypertension is that in preeclampsia, there is systemic organs are affected, but in gestational hypertension, it is not affected the systemic organ. Okay, so that is the three category of hypertension. Next, what happens, as you are going to study about the preeclampsia, so what happens during the preeclampsia, what are the features we find during the preeclampsia? So first one is the rise in blood pressure. As I told, there is a rise in blood pressure, that is 140 mmHg systolic, and more than that. And also in the diastolic, there is rise in blood pressure, that is 90 mmHg or more than that. Okay. So, and also preeclampsia is two type. One is there is another one, that is the severe preeclampsia is there. In that case, blood pressure increases 160 mm, up to that level, that range, that is 160 mmHg. And all that, similarly diastolic also increases 110 mmHg. Okay. Then one of the main, as I mentioned in the definitions, that there is proteinuria happens after 20 weeks of pregnancy. Okay. Then proteinuria is present. Proteinuria means the presence of protein in the urine. Okay. If there is some changes during the filtration in the glomerulus, so the protein particle moved in the urine, and that is present in the urine, that is called a proteinuria. The amount is 300 gram or more than that within 24 hours. Means within 24 hours, how much amount of protein is the amount of protein that is excreted in the urine is 300 milligram. Then if you go for dipstick method, dipstick matlab means it is the examinations to find out the presence of protein in the urine, one of the exams. So if you go for the dipstick examination investigation, then you find that the albumin is present in the urine, that is plus more than plus 1, that is that is the value, the number of albumin present in the urine. It can be known by the dipstick method. Then what are the risk factors? So who are more prone to preeclampsia? Those mother having young age, pregnancy during young age. Okay, so one of the factor, that is the pregnancy that takes place in the young age. And also pregnancy, young age. Then twins, pregnancy, polyhydramnios, diabetic mother, elderly preemie, and previous history of preeclampsia. Means if he has gone through in the early pregnancy, he also suffered with the preeclampsia feature in hypertension. There may be second chance of preeclampsia during the second delivery. And also the twins, one of the factor, polyhydramnios, elderly preemie, young age pregnancy takes place, that is in young age, and diabetic mother. These are what? These are the risk factor. Okay. So what are the sign and clinical features that takes place that are present in the patient with preeclampsia? So the sign and symptoms, there is a headache, one of the sign patient complaining, and the visual disturbance, that is a blurred vision. Vision will be blurred like. And next, hepatic pain, that is the epigastric. It takes place in the upper quadrant, that is the epigastric region. Okay. Next, reduce urine output. So there is this the urine outputs. If you observe the urinations output chart is maintained, then it is very low. Means reduce urine output. Then what are the on clinical examination? What you see during clinical examination? We find the hepatic tenderness. As I told, there is an liver epigastric pain is there. So if you feel the right side, then you find the hepatic tenderness. Okay. Then edema is present on the ankle and hands. Yeah, sometimes it may be present on the cheek. Yes. Then these are the what clinical features we found in pre-eclamptic patients. So what is pathophysiology? Why these are happening? Why blood pressure is rising? And why the protein is leak out from the urine? So that is we know from this pathophysiology. So if the cause is unknown, but there is no definite cause for pre-eclampsia. But it happens, the preeclampsia, the blood pressure rises just after pregnancy. So when the placenta is implanted in the maternal bed, so that time if there any abnormality, then it may be chances of pregnancy induced hypertension or the preeclampsia. So the one of the cause is the placental implantations. If during the placental implantations, if there is an inflammatory response is taken place, so that affects so due to the inflammatory response, some of the things, some of the changes that takes place in the maternal blood. So that's cause, that's why the mother has to face this type of problems. Okay, so during pregnancy, as we all know, prostaglandins, PGI2, that helps in vasodilations. Its presence in prostaglandin is present in our body, and that also is present in the side of the uterus. So the prostaglandin, in the presence of prostaglandin, vasodilation takes place. If the prostaglandin level is decreases, okay, then it leads to vasoconstriction. Similarly, there is another factor, that is the thrombxane. Prostaglandin level decreases, okay, with associated with thrombxane. This is one of the factor, okay. If its level is increases, okay, so what happens, they both, if they are both happens, there is what vasoconstriction takes place. Means vasoconstriction means narrowing of the diameter of the vessels. So that leads to what? Decreased blood supply to the different organ of our body. So that is the one of the factor, that is the vasoconstriction, and that's called vasospasm. And also that damage the endothelial layer of the vessels, that is called endothelial dysfunctions. Okay, so due to the placenta implantation in the maternal uterus, so there is some inflammatory maternal bed. So inflammatory response takes place in the placenta. So that's some of the things that enter into the maternal blood. So that's due to the presence of that things, that is increase of blood pressure, and also what they cause vasospasm and endothelial cell dysfunctions. Okay, so what happens? Now the blood vasoconstriction takes place, so that blood the amount of blood that is supplied to the different parties decreases. So as you see, the blood vessels. If there is any narrowing, means vasoconstriction, so what happens? The diameter is reduced. Now it's look like this. Okay, now the narrowing of the what endothelial the narrowing of the vessels, that leads to endothelial cell dysfunctions. Maybe there is necrosis takes place in the blood vessels. So what happens if it supply blood to the kidney? Okay, kidney that affect kidney. How? The kidney, in the Bowman capsule there is a filtration takes place. So in the filtration is, you know, in your as I discussed in earlier, so the afferent arterioles that carry blood for the glomerulus. Okay, here the ultrafiltration takes place, and the protein that is the essential thing that not come cannot filtrate in the glomerular capsules, that again back to the efferent arteriole. But if there is endothelial dysfunctions is there, so the cell present in the Bowman capsules that is permeable, means that allow the protein particle inside the tubules. So there is what? Presence of protein particle in the urine. So as I discussed, one of the characteristics means protein present in the urine. Next, it affects liver. If suppose it is liver supplying blood to the liver, if there is necrosis, means narrowing of the blood vessels, so what happens in the liver? So it affects the liver. The periportal layer of the, it's affect the periportal layer of the liver, means the outer surface of the liver, periportal. Okay, it's affect to the periportal, means outer layer of the outer surface of the liver, and that is what is called swelling takes place. Okay, so if you find in the clinical examinations, you find there is a tenderness in the right side at the epigastric region. Okay, so it is one of the factor, that is the liver tenderness and the swelling occurs. That leads to secrete to enzyme. Also it secretes to enzyme. Two enzymes are AST, and another one is that is the AST, that is called the aspartate transminase, and another one is alanine transminase. Okay, these are the enzymes that secreted if there is swelling or swelling in the liver. These two enzymes are secreted towards the blood, means maternal blood. That also another name for these are is SGOT and SGPT. So you see on the examination blood test, you find the level of increases, that is SGOT and SGPT. So as you know, it is affect to the liver. Similarly, it affects to the eye. So it's as it's affect to the eye, there is the narrowing of the blood vessels. So the blood supply to the eye is decreases. So one of the things that is present, you see, that is the blurred vision. Okay. Similarly, it also affect to the lungs. It's in lungs, it's called pulmonary edema, and also as I told, there is edema is one of the thing. If there is a the interstitial secretion that takes place from the towards the interstitial cell. So the due to the deposition of the plasma inside the interstitial cell, means the space between the cells. Okay, so when the blood in the it's blood, the blood carried to the vessels. When there is a blood movement from the vessels towards the cell, so that the excess plasma that is deposited on the on the space between the cell, so that leads to edema. So it can be feel in the ankle region and the hand, and also in severe case we find on the below the eye. So these are the symptoms, or these are the clinical features that's caused due to this rising blood pressures. So in this video we know about what is preeclampsia and the classification of hypertension and clinical features and the risk factors and the pathophysiology. Next, in next video we will discuss about how to manage a patient with the pre-eclamptic. Okay, so if hope you like this video, if you want to see more video, please subscribe my channel.